Welcome to a Shot in the Arm podcast. I'm your host, Ben Plumley, and this is a podcast about global health and human rights, and in particular, how advances in technology can improve the lives of people around the world. Well, this is the last episode in this current season, and it's been an absolute pleasure to do this in partnership with the Bay Area Global Health Alliance, a group of businesses in tech and biotech, academics, non-profits and community organizations, all committed to improving the health of people around the world. You can find out more about them at www.bayareaglobalhealth.org. And so to wrap off this season, I can't think of a better person to be chatting with than with the head of health at Facebook, KX Jin. KX, welcome to a Shot in the Arm podcast.
Ben, thank you for having me. Excited to be here.
So you're one of the earliest employees of Facebook. And there is that, I suppose, historical story of you meeting Mark Zuckerberg first day of classes at Harvard. What have been the highlights of your career at Facebook to date?
It's been quite a journey. I think I'm actually one of the first 20 or 30 users of Facebook all the way back in 2004. Graduated in 2006 and came out to Silicon Valley to work at Facebook for what I thought was probably going to be a year before I'd go back to grad school. I did my degree in computer science and psychology, mind-brain behavior at Harvard. So I joined Facebook as a software engineer, spent about 2 years working on Newsfeed. I joined 2 weeks before that product launched. So it was a very interesting time to join at the company. Then I spent 4 to 5 years in ads and helped build our early ad system. At the end of it, was responsible for ads engineering for the company. And then switched back into product afterward and spent a long time working on various products, mainly in the Facebook app, so the main app. Worked on Facebook groups, Messenger, some of our Messenger Kids products, and several other things. And about 2 years ago, switched into my current role as head of health.
Well, wonderful. I want to come on to that in a minute. What fascinates you and interests you about Facebook?
Yeah, it's been an interesting journey. I don't think it's anything that we envisioned, 14 or 16 years ago. I don't think anyone would have predicted a lot of these things. I think it's been fascinating around just how our products help facilitate human communication, how they facilitate people getting together, how they facilitate community, and the different ways we mirror society, the different ways we amplify things, both for good and bad, and how we can help support the good and minimize some of the harms. And I think it's both a tremendous opportunity as well as a tremendous responsibility, and that's really what motivates me.
Yeah, and I'd love to come back to some of those things later in the interview. So why, after a career as an engineer and then a founder of many of these new tools on the Facebook platform, why health? What got you into that?
Yeah, it's a interesting story. I think that has been a long time coming for me personally. It was a mix of both professional and personal. On the professional side, I think this is probably obvious, but we didn't really build any of our products with health-related use cases in mind. But kind of despite that, we were really seeing people getting a lot of value out of connecting around health on our platforms. And we were consistently hearing this from our users. So example around blood donations, we would hear from folks, especially internationally and in parts of the world that are more on the replacement model, where the burden of finding blood is more on the individual, that our tools were tremendously useful in helping them find donors in times of need. And we would also talk with the blood banks and organizations who are trying to build a voluntary approach. And we're also hearing from them that like Facebook and WhatsApp were widely used to build that. And that's just one example. We're hearing a lot on the group side, so both patient communities, clinician communities, and so on. And so we're really just seeing kind of this already happening, hearing such strong feedback around how valuable this is. And I think I was just feeling like if this is happening even without us really thinking about and designing products in this way, right? When we built Facebook groups, we were thinking more the college soccer team. We were definitely not thinking, some of these massive clinician groups, for example. Feeling like there was a real opportunity and in some cases a responsibility to better support these needs. And so that was something that had been building for a while on the professional side. On the personal side, my wife's a physician, so like we've been talking about the intersection of our two worlds for at least a decade. And I think it was really drawn home for us when we had our son. He's now 4. But when he was younger, I think at 7 or 8 months, he had a really severe anaphylactic reaction to peanut, like a cross contamination. And he has like a lot of food allergies, some of which are quite severe. And this is like super scary for us as parents. And it was not something we'd had to really work through before, because neither of us have allergies. And and really thankful for the access to care that we have. And he's obviously doing much better now. But one of the things that ended up being really valuable was talking with other parents, both online and offline, especially those who had gone through the same thing before. And we were able to connect with a few wonderful communities of parents online and on Facebook, actually. The irony is it took us like 6 months to even think to look on Facebook for some of these communities. Even though at the time I was literally leading the group's product. And a few of these were incredibly valuable. One of them is food allergy physician moms, which is, I guess, exactly like you would expect it to be.
Yeah.
And so I think like that kind of also just personally drove home some of the needs and value here. It highlights some of the disparities here. Obviously, we're really fortunate, but just connecting with some of the parents there really drove home that. So I had my second kid at the end of 2017 and came back from leave, really, I think, just wanting to be more intentional about the time that I spend at work. And I'd been talking about some of this internally for a while, had a set of really good, productive conversations with Mark and some of the other executives. And I'm just super grateful we were able to make an investment here as part of our social impact work. And that's kind of how this team got started, and my involvement in it got started starting around middle of 2018.
Well, fascinating. And I want to come on to talk about how Facebook has helped us get through this period of COVID, and indeed how it's working in other parts of the world to support particularly community organizations. But there's one thing that you've been very vocal about, and it's something I believe in very strongly too, and that is you're not a clinician. And that you've been clear that you don't believe that there is the need for a clinical or medical background to be doing the job that you do. Now, don't fall off your chair. I have a background in theology and then medical ethics. So I come at this, I think, very intentionally, not wanting to be a clinician and thinking that there's a value in joining the dots in the way people live, because everybody wants to be healthy. But could you talk about your reasons for feeling and for sort of knowing that that's not a crucial element of your job?
Yeah, I'm really glad you asked this. I think you don't need to be a clinician to understand the importance of health, right? This is probably the one thing that affects everyone. And I think the reality is that many different perspectives are needed to address health issues. Absolutely the clinical perspective. So I don't want to be downplaying that. That's an incredibly important and critical perspective to include. But you also need to think about the patient or individual perspective, their friends, family, caregivers, and public health and population health experts, in addition to just individual health. And I view part of my job is making sure all of these perspectives are represented in our work. And that's really how our team is shaped. We have people from all of these various kinds of backgrounds, including clinicians, health policy experts, in the context of COVID, epidemiology. And we also work with a lot of groups outside of Facebook, from the WHO to ministries of health and patient advocates. And I really believe that the best outcomes here, and like in a lot of things, happen when people with different backgrounds and disciplines come together and bring their complementary expertise toward a common goal, which is a healthier world in our case. And I think Facebook's role in health is to help facilitate bringing some of these people and organizations together in ways that improve health, especially through online channels. And I think that's what Facebook is uniquely positioned to do here.
Yeah, it's so funny because this is sort of what we were trying to do with the AIDS movement in the 80s and 90s, mostly by fax and telephone. But it seems to me that there's sort of been a really interesting aha moment for Facebook as COVID starts. And, it's been a critical tool for all of us to stay in touch with loved ones. My parents are in the middle of nowhere in the United Kingdom, and Facebook has been invaluable. Apart from my mother accusing me of breaking her Facebook every time that we try and chat, but I've been really surprised at the way in which, particularly community organizations, have been able to take the tools that exist now and use them for good. And the example I often use, and she was a guest on the show a couple of weeks ago, is a case manager called Dawn Skelton from the California Prostitutes Education Project over in Oakland, which is the main HIV tester and supporter for marginalized and homeless people living across the Bay. And, she's just been live streaming and making sure that all of her clients have Facebook or other social media accounts, but primarily Facebook, and then live streaming on a regular basis. There's a food bank here. You can get a COVID test here. Our mobile clinics are going to be in this place. Come and get a shower. And it's had extraordinary impact, KX. And for me, as a sort of a public health communications person, I was joking with someone from the Clinton Health Access Initiative yesterday. We used to work on rapid reports, policy reports, back at the beginning of the last decade, and rapid meant 6 months. Now I can get a live stream together on a policy issue, and it's a matter of hours. And so, I mean, how surprised have you been that Facebook has been used to build what can only be described as resilience, really, in this way?
Yeah, that's there's so many directions you can take that question. Because I think the reality is Facebook, and not just Facebook, online services in general, are being used in a lot of different ways. And I think some of the more positive ones, just stepping out of public health for a second, just staying connected with your friends and family, especially when there's reasons why you're physically distanced. My parents as well. They're actually just down the street, but for a long time they're older Americans, right? And so they're kind of sheltering in place and trying to maintain distance. And it was really great that I was able to see them on the big screen via video calls every day. And it's not something that I was able to do growing up with my grandparents, right, who were in China. And I think it's just like tremendously great that these tools exist for the human personal connection first and foremost. And we were seeing pretty substantial increases in demand for some of these messaging and more private services earlier in the pandemic, to the point where we had to scramble quite a bit to just keep our services up and running and reliable, which I think we generally were able to do, thankfully. And then I think the other angle you talked about, which is more around community organization and people organizing there. And I think there's a tremendous amount of potential here, both pre-pandemic, right? You have a lot of these patient advocacy groups and so on, or clinical clinician groups already organizing on Facebook, and then obviously accelerated post in a lot of ways. And lastly, I think you mentioned the like faster ways to learn and disseminate data and disseminate information, and even like get data from Facebook and from the people on Facebook. And that's also an area that I think, again, existed before the pandemic, but I think has been accelerated in a lot of ways during it. And I think there's a lot of potential there as well.
Yeah, I agree. And so it's been particularly interesting to me to see a group of Southern African women, both having a group, one of the groups you would have, helped build the technology to create, that provide support to each other on where to find their HIV medicines and how to manage with, difficult domestic circumstances if they're trapped at home with people who may be abusers. And they also have a live show that goes out across quite a few countries. And yes, this was happening before, but never with the same sort of intensity that COVID has forced on us. And I'm sort of don't want to seem overly simplistic, but to take you back to Harvard and the computer science course that Harvard offers, particularly the mind, body, and behavior components of sort of the cognitive science of things. And I've always been fascinated by that because it's about, it seems to me, adapting and improving the ways humans do things. It's about support, not replacing them, not forcing them to do things, but to sort of make it easier. And am I being overly simplistic in sort of thinking things in those terms?
I think it's a pretty good characterization. A lot of the technical advances over the last decade, I don't think have like fundamentally changed human behavior, right? Like these behaviors were always there. I think it's made it easier to do some things, right? Like whereas I don't know, a decade or two ago, if I wanted to talk to my grandparents in China, it was like a phone call that was $1 a minute on a terrible connection, right? And now it's just so much easier to do that. Same thing around a lot of the COVID response, like to be able to learn from other clinicians worldwide. A decade ago would have been that was happening and clearly a real need, but now you're seeing this play out in Facebook and in Twitter, Facebook groups, and so on. So I think it's really a lot of the technical shifts we've seen over the last decade have really just made connecting easier. And I think there's a tremendous amount of potential for good here. Some of the examples you mentioned, and there's plenty of others. And I think there's also some risks as well. And I think the shared challenge we have is how do we figure out how to bend these technologies for the good in the long run? And I am optimistic about that.
Well, that's right, because as you point out, there's another side of it, isn't there? The how do you balance freedom of expression with accuracy and preventing, I suppose, hate speech? And I know you've given a lot of thought to that. And again, if one sort of thinks about the algorithms as a way of helping people, do what they do in more effective ways, that's inevitably, for good and for bad. So how do you see Facebook walking that thin line, as it were?
Yeah, it's a really important question. So thank you for asking it. I think it's important to contextualize that misinformation isn't really unique to Facebook or online channels in general. This is something that has existed for a long time. Even if you're just talking about vaccines in the Western world, I think the Wakefield paper was published in 1998, right? Yeah. Which is well before the second wave. And I think, outside of the Western world, there's actually very real reasons why people might be distrustful of some of these things. That said, I think one of the lenses we want to apply is where is Facebook really amplifying things versus just mirroring things? And on the misinformation side, we focus a lot in reducing distribution of such content, and we work with fact-checking partners as well as organizations like the WHO to determine this. And in cases where some of this content can lead to imminent harm, we remove it. I think we've made a lot of progress here. A lot of my personal focus last year was actually organizing some of our vaccine misinformation efforts, making it so that if you search for terms like vaccines on Facebook, you get reasonable results from credible sources there. But we also have a lot more to do, including in getting better around viral content, the content that gets a lot of distribution. And I'd say like earlier in the pandemic, the first pandemic video was one that I think got more distribution than it probably should have, because we were just a little bit slower in enforcing some of our policies. I think more recently, pandemic 2, we did a better job on from that perspective. Again, just enforcing our current policies, but I think we have more work to do there. I think the other point and real learning here is that, or at least for me, is misinformation really thrives in the absence of credible and trusted information.
Absolutely, yes.
And having talked with a lot of folks, parents who had some hesitancy around vaccines, like they all fundamentally want what's best for their children, right? And so they're just looking for answers to their questions, and they're going to be looking online, they're going to be looking offline, and if the credible, trusted information isn't there when they're looking, that's where kind of misinformation really thrives. So it's just so important that we collectively meet people where they are here with empathy. I think a lot of just like the empathetic approach is incredibly important. And that's why we've also been working so much with a lot of these partners to provide that information and ideally provide it in an accessible and trusted way.
And I think one of the things that Facebook and others can do is help public health officials. We know what we need to say, but quite frankly, we can be absolutely the worst messenger. I happen to be on the board of MTV's Staying Alive Foundation, that has spent its career, since the mid-90s, just building, dramas, soap operas in Southern Africa about HIV and sexual reproductive health in ways that kids understand. And they've actually done a series of short videos alone together that, talk about the issues with COVID. And they can do that in a way that perhaps older middle-aged men like me and colleagues at WHO and other places, we may know what needs to be said, but we're not going to be respected vehicles and messengers of that. And so I'm very interested in the way that, the credibility of Facebook has been able to get those messages across.
Yeah, that's a great point. And it's one of the areas I'm most optimistic about going forward. It's really about how do we help drive offline behavior change through online channels? And in order to do that well, I think it really requires a combining of different disciplines, right? A lot of the public health experts we've talked to are incredibly clear on what behavior changes actually need to happen, like whether that's mask wearing or physical distancing in the context of the pandemic, or vaccinations, right? I think the challenge from like that to actually helping make the behavior happen is pretty massive. And I think this is where some of these other disciplines, including public health communication, right? That's a sub-discipline, as well as just bringing in like media or advertising or some of these other perspectives, I think is going to be really fruitful. And the good news is I think there are already examples here of successes that have happened over the last few years and in the context of the pandemic that we can learn from. A couple ones that I'm familiar with. So HPV vaccination rates in Ireland and Denmark both declined quite a bit over like 5 years ago or 5 or 6 years ago. And both of those countries were actually able to arrest those declines and start moving them back up. And I think the approach was a very collaborative cross-sector approach, fundamentally meeting people where they are, with empathetic messaging and meeting parents too, where they are with empathetic messaging across online and offline channels. And I think it's like a great success story and something that can be built off of.
Yeah.
In South Africa, there's this program called Mom Connect that is going on for many years now. And I think it's for expectant mothers to enroll stage-based messaging over initially SMS and now WhatsApp. And I think at this point, over half of all expectant mothers in South Africa enroll in this program. And the majority of those people enroll on WhatsApp as well. And so there's some real interesting things there. There's a lot more, but I think a lot of this, like, how do we work together to understand online to offline behavior change is incredibly important.
And I suppose for some of our listeners and viewers who don't fully understand these things, WhatsApp is a company of Facebook, right? It's
That's right. So I think Facebook, the company, which includes the actual Facebook app, Instagram, WhatsApp, Facebook Messenger, and a few other properties as well.
And certainly across Africa and Southeast Asia, WhatsApp is absolutely essential. And I'm loosely involved in a number of networks, whether it's for HIV treatment or the experiences of women surviving breast cancer. There's a whole lot of things going on there. From the public health perspective, KX, there was one other question I've been really dying to ask you, and it's about monitoring and evaluation. And obviously, strict regulation and strict practice around how we identify advances in biomedical research, absolutely clear, absolutely needed. It's been more of a challenge, frankly, in the behavioral science and program implementation areas. It's become more important in the last decade because money has been stagnating for global health. But for those of us working in public health, M&E is necessary, but it sends a shot of fear down our backs because it can be so complex. And what I would be really interested in knowing is whether you've experienced that in how you've adapted monitoring and evaluation in your environment.
Yeah, that's a great question. I think this is incredibly important, right? Because at the end of the day, it's not how much people engage on something on Facebook or WhatsApp that matters. It's whether they're actually taking the behavior change that's having the expected impact from the health perspective. We've attacked this in a few ways. I don't think we have all the answers, and there's no silver bullet. But a few interesting things we've done. The blood donations product is a really good example. So when we rolled out our blood donations product in the United States, we were able to do a staged rollout in conjunction with our partners, and essentially basically say half the country got it on day one and the rest got it, like 8, 12, 16 weeks later. And this allowed us to do a difference in difference study, or really our partners to do that. And the Red Cross and a lot of the other partners actually have quite good data on per blood bank basis for just how many people donated on a given day and how many first-time donors came in as well. And one of the really interesting results was we were able to show that there was a 19% increase countrywide in first-time blood donors showing up at the blood bank themselves through the rollout of our tool. So I think that's an example. I think we need to do a lot more of this in general in partnership with the partners we work with. And there's a tremendous amount going on actually in the context of COVID right now, because I'd say, and this isn't Facebook specific, but I think a lot of partners are probably running some of the largest scale public, behavior change campaigns that have really been done in my lifetime. And I think it's quite important we learn what's working and what's not, so we can focus on the things that are working and, scaling those things out. And along those lines, there was a really interesting study. It needs to be replicated that came out of MIT earlier this year, where essentially, I think a Nobel Prize winning economist recorded a set of videos and then partnered with Reliance Jio in India to send these videos, short videos, over SMS to people in India. And the videos are really, exhorting the importance of reporting symptoms to a community health worker and limiting, travel between villages. And they were able to set it up in such a way that they had a control arm that didn't receive the video, and then were able to show pretty significant effects in reported symptoms to health workers, as well as decreases in mobility. And I think the more we can learn from studies like that, the better. And that had, I think, all of the elements you mentioned earlier around. It was a trusted messenger that was widely known in that community, with a message that they, I think, had tested and honed a little bit for the norms of the community, and delivered in a medium, SMS and video that was resonant with people. So I think there's a lot more along these lines that needs to be done.
Okay. Well, KX, just one other question then, really around, if I may, your nonprofits expertise. You've spoken about health, but education is also very important to you. And it strikes me that it's always very good to give people the opportunity to profile their nonprofit experience, their board experience. You're on the board of an organization called Chalkbeats that looks at using the media to improve understanding how to improve schools. How did you get into that?
Yeah, thanks for asking. So Chalkbeat is a nonprofit news.
Sorry, I can't read my own writing.
Chalkbeat, like a journalist beat, right? Chalkbeat. They're a nonprofit news organization based in the United States that is really committed to local reporting around education disparities for policy change. And so they have a really interesting model that, or I guess we have a really interesting model that's embedded in the local communities. So we have a bureau in Memphis, in Newark, in Detroit, and then probably like 7 or 8 other local communities. I've been involved in this organization on the board for at least 5 years. I know the CEO for. Actually, we're on the high school newspaper together. So then we went to college together. And yeah, I've been really struck by how much overlap there is in some of the work that Chalkbeat does and some of the work we're also doing, I'm doing on the health side. A lot of health issues are also inherently local. There's a real need for both accountability journalism and service journalism here. And I think one of the most both heartbreaking and kind of like as difficult things was a lot of parents rely on schools for food, like meals for their kids, right? And so when all the schools shut down, this became a massive problem. And what Chalkbeat ended up doing was creating these maps, basically around like if you're a parent who is reliant on meals for your kids from the school system, here's where you can go to get meals for the school systems that are still offering them. And those food maps actually were like the most used thing that Chalkbeat had ever produced. And I think it just really shows that like a lot of these issues and the disparities that are being magnified here are quite interrelated, and a real need for both the services to help reduce some of these disparities, as well as awareness of the ones that are currently available, because I don't think they're fully utilized.
And of course, another nonprofit you're involved in, it's our partner for this show, is the Bay Area Global Health Alliance, and that's about bringing the benefits of technology to building global health equity. And it's also about building greater awareness about health in the Silicon Valley field. And I would love to know your thoughts, your advice on how we might be able to build the alliance as a champion for engaging more tech companies in health.
A great question. I mean, I'd say the Alliance has already been incredibly successful in convening and bringing a lot of these organizations together. I think we were talking at the beginning about how we first met earlier this year under the auspices of the Alliance. So I think already from that perspective, it's been quite successful. I really think a lot of there's a lot we can each learn from each other. And I think we actually do share a lot of these goals on the health side. And I'm just excited to both continue to have some of these conversations, share these contexts, and then find ways to take concrete steps together to realize some of these goals.
Yeah, I think there's a real mutual conversation to be built there that is sort of fairly unique to the Bay Area.
Yeah, and I think there's some things that are relatively easy for certain tech companies are really hard for parts of the public health community, and vice versa, right? And I think really understanding each organization's unique strengths and then figuring out how we can apply those together toward common problems is the real opportunity here.
Well, KX, we've sort of come to the end of our time. Normally I ask our guests, how do they stay sane during this period of lockdown? But it sounds like you've got your hands full, both with the company and with the family. But any advice you can give us?
I don't know. I feel like I should be asking you for advice.
Oh no! Don't be asking me. We binge watched the entire narrative chronology of Aliens last week, so I'm probably not the people to ask.
I'd say it's a really unprecedented situation. I'm super grateful for the opportunity to be able to contribute on the professional side in some way. And I'm sure, as with everyone, there's just a lot going on. And obviously, we're much more fortunate than most. Yeah. So I feel a tremendous amount of responsibility, too, to try to help.
Well, KX, thank you so much for being on the show. We really appreciate it. We hope to be working much more closely with you in the future, and certainly your head of health partnerships, Praveen Raja, will be joining us in the next season of A Shot in the Arm podcast. But just to say thank you so much for everything that you're doing, and stay healthy and stay safe.
Thank you. Same to you.
Cheers. Well, that's it for this episode, and indeed this season. Our thanks to KX. Thanks also to Sarah Anderson from the Bay Area Global Health Alliance. Thanks to Erica Spera from NewsDoc Media, our producer and director. And of course, a big thanks to you. Now, we'll only be gone a couple of weeks, but don't hesitate to contact us if you have any suggestions or thoughts. You can find us on YouTube, Twitter, and Facebook at Shot Arm Podcast. And you can find this and every other episode on the podcast platform of your choice. So have a safe time and a healthy time, and don't forget to wear your mask.